I'm Fred Johnson. I teach history at Hope College, and I guess I'm going to throw this out to the whole panel. I talked to a doctor up north who said that despite all the details of how a system might look, what has to be done first is we have to make a decision. Are we going to provide health care to people as a nation, take care of all the people who don't have any health care, or not? And he said, depending upon how we answer that question, that will drive whatever happens after that. Because for him, it wasn't a question of details, although details are obvious. It's a question of if you want to call it the moral commitment of a nation, having our capacity, having our wealth, having our systems. Are we going to do this or not? That will say a lot about who we are as a people, and then what we do with our resources. The big issue is, do we have the moral commitment to do it? I'd like for you all to respond to that.
I think that's the right question to ask. I think, yeah, and I think we should say, hey, by 2014 or 2013, we are going to cover everyone, and then figure out how to get there.
Audience, what do you think? Maybe the simplest question of the night. A, if you agree we should have health care, despite the cost, despite the possible imperfections, or B, if you do not think we should. So please go ahead and vote, audience.
Health care or health care coverage for all are two different propositions. Health care is something, insurance coverage is something totally different. We could cover everybody. If we did it with today's current health care economics, an economic system where an MRI costs about $88 to perform, but the charge is $1,745, is that a system we want to say insurance is going to pay $1,745 for something that doesn't cost it? And yet, the time Dr. Olson spends with a patient, we don't even regard. That's not worth paying for at all. Is that the system we are saying, boy, we want to mandate everybody to do, or do we have to rearrange things so that we pay attention to cost, we pay attention to efficacy, doing things that work, and then make sure they're covered? When it comes down to it, the decision of is health care a right or a privilege is really answered in an emergency room. Whether people have taken care of themselves or not, if they become a train wreck of some kind and present themselves, they are going to be taken care of at a very high cost. They haven't done the things that Dr. Gleason would like us to do, and problems occur, they become very expensive. You still have to go beyond that question with health care coverage, at what cost, at what area of responsibility, for what area of efficacy, with what incentive to do the right thing.
84% of the audience agreed that we need some type of health care system here.
I think that's something that's sorely missing from the healthcare debate right now. It's like our country's in a bubble, and we look at our system and we say, how can we make this better, without looking at anything else that's working? That's one advantage, if you can call it that, to being so far behind the curve like we are. We do have 36 different models we can look at out there of tried systems in the real world that work and produce better results than ours. I wondered if you leaned one way or the other as to any of the countries you looked at, what would be best applied here?
Well, I guess the Medicare for all suits me, and I know there are people in this audience that don't agree with me on that. But I think it would be Medicare for all as long as we redesign the delivery system. You know, that is that we maybe bring in these medical homes, or we have these multi-specialty physician or multi-specialty groups, and that we create a system that takes care of the health of the community that we live in, rather than having it just be an individual fee every single time that somebody comes in the office. But we have Medicare, we're familiar with Medicare. Our people over 65 don't want to give up their Medicare. And so it seems to me that if you take a system that you already have and then you build on it, I guess that makes the most sense to me. But Lodi's the expert.
Not an expert, but I'm going to suggest two things. One, if you go to France, if you go to Germany, one of the biggest threats politically they have and that they use, whenever someone suggests some change, they say, oh my God, you're trying to make our system like the American system? We can't afford that. It becomes a threat. If you look to where Canada was when they first implemented their program, which was a provincial program, what was behind it had a lot of sense. It's changed over time, but they basically mandated a basic level of care for every Canadian. Basic meat and potato care was there for all. Insurance companies were prohibited from duplicating that coverage because the base coverage would be taken care of through a tax system. However, they encouraged insurance companies to stay in Canada and write coverage for the things above and beyond the basics. An example, everybody could get into a semi-private room, and nobody could write a benefit for a semi-private room. But if you wanted a private room and wanted to pay extra, you could buy an insurance policy to give you that amenity. You could buy an insurance policy to give you a TV in your room. Other people might not. So you can buy things above and beyond, but the basic level of care was mandated to be the same as all. That's changed since that time, but it seems that would be an area where you can blend private enterprise with basic coverage and make sure that you do have that level of coverage for all.
My question to the panel is, given the fact that survey says in the audience that the vast majority of people in this room, at least among the 32 that hit the clickers, agreed with Dr. Gleason that prevention and individual responsibility should be part of the argument. On the other hand, I've yet to hear in the healthcare argument that prevention and individual responsibility is included. I'd like to know why and what your position is.
It's in the design of the system, which we don't have now. And, you know, in Britain, they have this, most of their care comes through this GP, and the GP is actually paid to do prevention. He gets incentives to do prevention and other incentives to provide quality care. In our healthcare system now, the insurance companies are trying to do that to a certain degree. So in my practice, I get monitored by the insurance companies, and if I succeed in getting 80% of mammograms in patients who are eligible, then I get a few more dollars. And it's, you know, in our system, it's not worth the effort that we go to fill in the blanks so that we can send it to the insurance companies, but still there is some incentive that way. And I think if we create a system that includes that, I think that would be helpful. Now, diet and exercise, I mean, I don't know how you can mandate that or include that. I don't have any ideas about how to do that, but maybe Dan does.
Well, I think we get too narrow in our focus when we're talking about insurance and healthcare providers. We really need to think about farm policy and policies like Walmart and McDonald's, who only have part-time employees to avoid paying insurance. I mean, why shouldn't there be a law that says if you work half-time for McDonald's, that McDonald's pays half of your insurance? I mean, why is there kind of this all or nothing? And then why are things like corn and soybeans subsidized, you know, that destroy our health? And then we have to pay for diabetic care because people are eating all these corn-based foods. I mean, it goes a lot further than just health care.
Just quickly, I think we just also need to have a moral discussion. Maybe that's what we're doing tonight. But and to have leaders that are willing to talk that way. I remember, and I think Obama's done all right. And then we have, of course, a lot of people under him. But I remember when he gives his speech to the nation, he's going to have to show how it's in everyone's self-interest to do this. Well, or the middle class's self-interest, or, you know, his constituents. Well, why not talk about what's good for society, and let's talk about what's good for society rather than continually having to say, well, what is in my self-interest, and how can we get a bill that's in my constituents' best interest? Well, why not we have a bill that's good for society and think of it that way and have leaders willing to talk that way?